Have you ever searched endless days or weeks for a microsurgeon to perform your breast reconstruction? Access to care is a real concern for patients who are affected by breast cancer. Finding a plastic surgeon who specializes in tissue reconstruction in the area you live is not always a service afforded to all patients. Traveling for breast reconstruction is not out of the ordinary and certainly wasn't for me even 9 years ago when I had my own DIEP flap. I want to bring awareness to microsurgical services in various geographic regions and interview surgeons to assist patients who are looking for a reconstructive surgeon. So I'm introducing a new surgeon for listeners and viewers. I hope this helps streamline the time you are taking during an already difficult time in your life. My guest practices in the state of Louisiana, but takes patients from all over the U.S. We have other microsurgeons on the podcast, the Deep Sea Journey podcast, and also the Deep Sea Foundation YouTube channel in different regions. So please check those out too. Let me introduce her. Dr. Sarosh Zafar is a double board certified microsurgeon in plastic surgery and reconstructive surgery and general surgery. She specializes in the most advanced methods for breast reconstruction, complex reconstruction, and microsurgery. Dr. Zafar joined the team of pioneering surgeons at the Center for Restorative Breast Surgery and the St. Charles Surgical Hospital in 2021. She's a native of Pennsylvania, and Dr. Zafar received her bachelor's in science degree from Villanova University, where she graduated with summa cum laude honors. She then received her medical degree from Drexel University College of Medicine, where she also completed a full residency in general surgery. She then completed her residency in plastic surgery at Houston Methodist Hospital in the Texas Medical Center, followed by a fellowship in microsurgery at the University of California in San Francisco. Recently, Dr. Zafar worked at Our Lady of Lourdes Regional Medical Center in Lafayette, Louisiana, in the Department of Plastic Surgery, where she was the only fellowship-trained microvascular surgeon in the region and quickly developed a reputation for excellence. She also served as a vice chief medical officer in the surgery department at Virginia Physician Group, a part of the Virginia Hospital Center in Arlington, Virginia. And Dr. Zafar is also widely published in the field of post-mastectomy breast reconstruction and has presented at numerous national meetings, including the American Society of Reconstructive Microsurgeons. And Dr. Zafar has also served as a surgeon for Operation San Jose, providing humanitarian cleft lip and palate care for patients in Chihuahua, Mexico. Dr. Zafar, thank you so much for taking time today out of your very full practice and schedule to talk to our listeners and viewers. I'm really happy to have you.
Thank you so much, Terry. Thank you for that introduction. Reminds me of all of my travels and all the different places I've lived. So thank you so much for that.
Yeah, it's probably kind of interesting to revisit that when you get these bios read for interviews, isn't it? Takes you
Yeah,
through
sometimes it
kind
takes
of
me
a
back through the entire process. Yeah,
exactly,
absolutely.
exactly. Well, let's start with that. So microsurgery, it's a very specific field in plastic surgery. What inspired you to go into the field?
Well, once I was sort of in the field of surgery, I knew that I wanted to go into something that was going to have some variety, options, and I wasn't quite sure exactly what part of surgery I was going to enjoy. And so, as a medical student, I actually went into general for surgery first. And then I became sort of fascinated with the technical aspect and just sort of the precision of surgery that happens within plastic surgery.
Mm.
And then within plastic surgery training, I initially had a lot of interest in pediatric, like cleft lip and palate surgery. But once I started doing these microsurgery cases, I just absolutely fell in love with the technical component of it. And then taking care of the breast cancer patients, which is the most common, form of microsurgery that we practice within plastic surgery,
Mhm.
is really what inspired me the most. And I thought, this is something where I can help women, help their families, help their loved ones, and still technically feel very challenged. And I do continue to feel challenged every day. And I think I will for my entire career, just like all microsurgeons probably tell you. But I feel very lucky and blessed that I found a great combination of, a field within surgery that I think is very challenging, which is what most surgeons need in their lives, but also where I feel like I'm helping so many women, helping a lot of women who have difficulty finding a surgeon in their area, a lot of women who are scared to have reconstruction, a lot
Mhm.
of women who are very hesitant to have reconstruction. Um, and so I feel very lucky and blessed where I am right now.
So you really, and I hear this often, you've combined in the breast cancer space and plastic surgery and microsurgery, you've combined compassion, which obviously you exude here in your conversation, as well as your surgical prowess and skills. And as you said, I have heard that said so often. It is a constant learning opportunity for surgeons. So that was really a good summation. So what is the track? Just real briefly. I know I went over your bio, but for you and for other microsurgeons who are going into the field of breast reconstruction, microvascular surgery, what is the track quickly?
So after medical school, you either go in directly into plastic surgery training, or
Mhm.
some of us have done ENT first, or orthopedics, or general surgery, or even oral maxillofacial surgery.
Mhm.
And then, for people like myself, I didn't realize or think that I wanted to go into plastic surgery when I was a medical student. But once you complete your microsurgery, your plastic surgery training, then there is the option to do one additional year of specialized training in microsurgery, where you focus on doing the flap surgery and sort of getting the repeats in, getting the numbers in, and gaining more and more independence in the operating room still as a trainee prior to
Mhm.
going out into practice.
Yeah. Okay.
And it's
Um,
not everyone who does a high volume of microsurgical reconstruction has not done that fellowship. Years ago, there was no such thing as a microsurgery fellowship. So, the founding surgeons here, Doctors Delacroix and Sullivan, there was no microsurgery fellowship when they were coming out of training. So it
exactly.
sort of, there's a variety of depending on where you trained, when you trained. And so there's a variety of paths to sort of get to this point, I would say.
Yeah. I think the key for patients to ask, because I've had this discussion before, Dr. Zafar, I think the key for patients to ask is what was their focus in microsurgery for breast reconstruction, whether it was a fellowship or a focused program, correct?
Definitely.
Yeah.
Yeah, I would definitely agree with that.
Yeah. So what is it that you guys perform? When I say you guys, your surgeon colleagues, I should say, perform at the Center for Restorative Breast Surgery in New Orleans? Because I know you do a variety of microsurgical flaps.
We We offer all of the different types of flaps
Hmm.
that patients could possibly need for breast reconstruction, and we also do implant reconstruction.
Hmm.
We also do hybrid reconstruction, which is using some of your own tissue and an implant at the same time, at the time of your mastectomy, or in a delayed fashion. And so, really, we like to say that we offer all the sandwiches at the deli, meaning whatever you need, whatever you come in for, we could help try figure out what is going to be the best thing for you. I would say still the gold standard is using tissue from the abdomen, whether that's in the form of a deep or an apex or some other variation of abdominally based reconstruction. We also do a very large volume of S-gap reconstruction, which is taking extra skin and fatty tissue from the upper buttocks area.
Hmm.
And then we still do a large volume of what's called TDAP reconstruction, which is using the skin and the fatty tissue from the upper back, sort of where the bra line sits,
Mhm.
for partial or sometimes for complete breast reconstruction.
Okay. And really, patients need to see you, one way or the other to determine all of that because we just can't assume that everyone's going to be a candidate for using their tummy tissue. It just
Correct.
depends on a lot of things, and that involves an assessment with your plastic surgeon. And I'm I'm really pleased these days, Dr. Zafar, that although I had deep flap, um, I know that there are patients that are not candidates, and I'm just really happy and pleased about the fact that we can use other parts of the body with a good blood source that have
Mhm.
good tissue that mimics the breast that you microvascular surgeons are able to use.
Yeah, we feel like in the right patients, there's no replacement for using your own tissue.
Yeah.
And a lot of the times it just comes down to seeing a patient or seeing, we can't always see every patient at the first encounter. Sometimes we have to have patients send pictures and photos so that we
Mhm.
can do general photo review. But you're right, there's no replacement for seeing patients and examining them in person. And so we have to usually do a physical exam, assess all the different donor areas, where the tissue could come from, and then help you decide and come up with a plan together. And I think
Mhm.
that's probably the most critical part of the process is sitting down with patients, talking to them, trying to get to know them and their experience, how they feel about their breasts, how they feel about their bodies. And that combination with our exam helps us come to a plan together. And that's
Mhm.
really the critical part is talking to patients and coming with a plan together. It's almost never, I walk into a room and say, this is what you should do. I don't really kind of practice surgery that way. I don't think it's the best thing for patients. And of course, if it were me having any of these things done, I would want it to be a conversation. So I always strive for that with patients too.
Shared decision making.
Absolutely.
Yes.
Always. Always.
Always, always.
Yeah.
Well, what do you see, speaking of shared decision making in this whole decisional process, what do you see the biggest challenges for patients are? Maybe even hearing it from your point of view uh, will kind of help the listeners maybe sort through all of that prior to seeing a surgeon if they hear it. What do you think the biggest challenges you face are in the decisional process for patients?
For me, one of the biggest challenges is getting patients up to speed and understanding everything in the short period of time that they have, especially our patients who are newly diagnosed,
Mhm.
who all of a sudden your life is just completely flipped upside down. You're newly diagnosed, it's scary. It's scary for you, for your family. You have to deal with work and taking time off from work for a lot of women. And then you have this critical time period where you want to get the cancer out as fast as possible. But also long term, you want things to look good and you want things to look reasonable and you want to feel whole again after this whole process is over, as much as it can be over. And so getting patients up to speed in the immediate reconstruction setting, I would say is probably the most challenging thing.
Mhm.
Um, I do think that there is good information out there, and there are really great support groups and networks that women have access to with the internet now that weren't as present 10 or 15 or 20 years ago.
Mhm.
And so those can be really great resources. Just always remember as patients that just like everyone's DNA is different, everyone's diagnosis is different, everyone's cancer is different, and everyone's reconstruction is going to be a little bit different. And as much as we tend to compare ourselves to other women, this is definitely one time when you don't want to compare yourself to other women in terms of the reconstruction process because it can be very different for two different women.
Absolutely. That is really good advice, I think, because you know, some patients come in with a lot of expectations and others have very few. So
Yeah.
that spectrum is what patients and surgeons have to flesh out and work out together in that shared decision-making model that you were talking about. So now I know you mentioned your team that you work with. I really am trying to emphasize the value of this co-surgeon model right now because I think it's valuable for patients to know about this. I know it's not possible in all circumstances, but in terms of value to patients, what can you speak to us about the value of the co-surgeon model?
The value is, well, specifically for our group, I will say that we have 6 plastic surgeons. We're all microsurgeons. All of us perform breast microsurgery routinely. It's just a normal part of our day at work.
Mhm.
And all of us co-surgeon with each other. Whenever any of us has a flap, someone else is actually assigned to be co-surgeon with us. And so the primary surgeon will do the majority of the surgery, and the co-surgeon will come and fill in and help shorten the length of anesthesia for the surgery.
Mhm.
And also it's been, proven through multiple studies when 2 microsurgeons co-surgeon for microsurgical reconstruction, especially in breast surgery, the outcomes are significantly improved in terms of less complications, like I said, less anesthesia time, greater flap success, less fat necrosis, all of those critical things that are extremely important to patients long term for their
Mhm.
reconstruction and for their donor site function as well. And so we really love the co-surgeon model. I very selfishly love to operate with all the surgeons here because all of us love to work with each other. We're all great partners. I love seeing how different surgeons do things, and then that helps all of us kind of change how we operate and change how we do things as well.
Mhm.
So we are very, very strong believers in the co-surgeon model here, definitely.
I'm really glad you brought up the studies because you are the third microsurgeon in no less than a month that I have interviewed. And it's not just here in the US, it is, across the pond too, mentioning the value of the co-surgeon model and these studies that have come out speaking about this. So, and also patients are exiting hospital sooner. I know
Mhm.
that sometimes I will just add a personal note. Sometimes, before you get into the situation, before you have your surgery, sometimes you feel like, well, gosh, I need to stay in the hospital as long as I can, so I'm cared for. Once your surgery is done, at least for me, I was ready to get out of there. And so
Mhm.
the co-surgeon model just helps with that, I think. So, yeah, really great points that you brought up. So let's talk about the pathway for patients to find you because it's going to be similar, I think, for anyone listening to this who might have to travel. Tell us about that pathway to find your practice.
Well, the easiest thing to do is to go to our website, which is very simple. It's just breastcenter.com.
Mhm.
And in fact, if you just Google breast reconstruction, we are probably one of the first practices that you'll find on a
Mhm.
simple Google search. And if you go
Right.
on the website, you'll find information there about how to contact. And then we have an entire intake team who can help patients and does help patients navigate through the beginning stages of the process here.
Mhm.
And I would tell you that I think one of our biggest strengths here is our team-based approach to taking care of patients. I know, and all the surgeons here know, it takes so much more than just the surgeon to get patients through this process. We are just one little part of the whole process. But we're surrounded by our intake team, our nurses, our staff in the operating room, all of our PAs. We have 10 PAs in our practice, and they're all phenomenal. All of the nurses in our on our nursing unit on the floor. We have our own freestanding hospital. And so our group of sort of team members collaborate, work together, and help patients get through the entire process. So once a patient would contact our center, someone from our intake team would contact them via phone call and talk to them and get a thorough medical history from them. We do ask patients to send photos, and I know personally I would hate to have to send photos, but it is a critical part of the whole process, and most patients are very understanding about it. And then our intake team will process all of that information and package everything so that it can be passed along to the surgeons. And then we review that information and give sort of our preliminary thoughts or a couple different options. And our intake team then reviews those with patients. And then if our patients feel like it's the right place for them and that it is a place that they can travel to, then usually our financial office will get involved to help sort through the entire insurance process, which I always tell patients I'm just a simple microsurgeon and the insurance and financial process is very complicated. So we have a whole team of people who do that part. Thank God we have a whole team of people who do that part and
Oh my
help patients
gosh.
with. I know it's
That's a
just
whole that's a whole nother
it's
beast, isn't it?
it is truly a beast.
Yeah.
But once that part is sort of sorted through, we also have a travel coordinator who can help with travel plans. Most of our patients do travel and come in from out of state. So about 65% of our patients come in from out of state. So we are very used to working with patients who travel. We do require patients to stay in town even after their surgery for a certain number of days for safety reasons. And then they are sort of allowed to go back to wherever they came from. Some of our patients come in from, a mile away right here in New Orleans, and some are coming in from Alaska, Hawaii, international patients as well. And so our entire team sort of has that experience and helps patients navigate through that whole process. It sounds very scary and very intimidating, but I always tell patients like, hey, this is about how 60% or so of our patients sort of get through the process here. And if all of them can do it, you can do it too. Definitely.
Yeah, and when I traveled, Dr. Zafar, too, it almost gave me a sense of control when I finally made the decision where I was going to go, because, then the planning began. So for you, what you're talking about, all these cogs in the wheel, the patient is at the center and they're all working.
Absolutely.
Yeah, to help the patient.
Always.
Yeah.
Absolutely.
Well, this has been a great discussion today. There's one other thing I want to mention because I know there are other places that they can find your group. Just in the past year or so, there's been several practices, microsurgical practices now, that have joined a microsurgical group of private practice surgeons, and it's under ARSA. Under the ARSA network, then there is IFAR. And so can you just briefly tell us how they can also find you via that network?
So the general umbrella of the ARSA group
Mhm.
includes multiple private practices throughout the entire country, East Coast to West Coast and everywhere in between.
Mhm.
And it's actually a phenomenal group of surgeons who have come together to exchange ideas, to exchange some administrative help throughout the ARSA umbrella, to collaborate, to be able to help take care of patients in different parts of the country. And within that group are multiple practices. One of the larger practices is in New Jersey, based in New Jersey, and that is the Institute for Advanced Reconstruction. And most of the physicians within the ARSA group also can be found on their website as well. Some of the, microsurgical groups are located within New Jersey, New Orleans. There's a great group in Ohio, in the Midwest, Houston, San Antonio, of course. The West Coast Bunkie Clinic also is within the ARSA group, which is a very, very well-known microsurgical practice.
Right.
And they do a whole variety of different types of microsurgery as well.
Yeah. So I need to give a shout out because I couldn't remember the acronym. It's Advanced Reconstructive Surgery Alliance. So think of that word alliance. And also, I will put in the show notes, and also when we repurpose this for YouTube, I will put a link both to your site in New Orleans, but also to the ARSA and the IFAR pathway to look for surgeons there as well for our listeners. Again, Dr. Sarosh Zafar in New Orleans, Thank you so much for joining us today and sharing this valuable information for patients so that we can help them find great microsurgeons across the country for their reconstruction. I really appreciate your time today.
Of course. Thank you so much, Terry. If patients have any questions, never hesitate. That would be my number one message. Always ask. Always ask for clarification. It can be a very confusing, intimidating process, but that's what we're here for, is to help you figure everything out and help you get the best outcome that you can.
Those are very comforting words to end on. Thank you so much.
Thank you, Terry. Appreciate
Mhm.
it.